The Best Practice Spotlight Organization Planning Committee is responsible for Bluewater Health's successful designation as a Registered Nurses Association of Ontario Best Practice Spotlight Organization. They attended training to become best practice champions and laid the framework to bring Bluewater Health from BPSO candidacy to designation. Their primary deliverables were to plan, implement, evaluate, and sustain 6 best practice guidelines: client-centered care, establishing therapeutic relationships, supporting and strengthening families through expected and unexpected life events, assessment and management of pain, preventing falls and fall injuries in the older adult, and integrating smoking cessation into daily nursing practice. During the last year of candidacy, an additional BPG was implemented: facilitating client-centered care learning. The Big 3 guidelines are representative of the core principles of patient and family-centered care. With the introduction of Emily in 2013, this team incorporated her into their dialogue, and she quickly became present at each BPSO launch. The core concept of the champion model is point-of-care leadership, emphasizing the person closest to the work leads the work through peer-to-peer collaboration to facilitate required changes in practice to meet best practice recommendations. The BPSO Planning Committee trained together to become champions. They learned how to promote engagement with their peers and drew upon each other's strengths and expertise, supporting and learning from each other. They met monthly to plan implementation, evaluation, and sustainability strategies, and mentored advanced clinical practice fellowships. This team demonstrated tenacity and resilience as they rode the roller coaster of change, engaging their peers through collaboration to embrace numerous evidence-based best practice recommendations. The Drug Access Facilitator role is a new position created for the Oncology Outpatient Pharmacy. The DAFs are registered pharmacy technicians who have worked in the inpatient pharmacy for many years. The team's objective was to become drug reimbursement experts who could advocate for our patients by negotiating drug access for the many cancer drugs administered at home or in hospital which are not funded by the public health system and insurance. The team went out on a limb and applied for a trial of the new, relatively undefined DAF role, based on the idea that our patients should have the same access to cancer drugs as regional cancer center patients without needing to travel for them. Obtaining reimbursement and access for treatment has been fragmented with multiple stakeholders, including patients, involved in the process. To be successful, the DAFs had to gain the trust and respect of the oncologist and the clinic family practitioner, nursing staff, and the nurse navigator. They had to develop relationships with numerous pharmaceutical and insurance companies. The team has been able to expedite the Exceptional Access Program approval rates from the provincial funding body from 6 to 8 weeks to 5 to 7 days, dramatically reducing a patient's wait time to treatment. In 2015, the team saved a total of $160,000 of our patients' personal money. This was achieved by obtaining compassionate funding through drug companies, advocating on patients' behalf to their insurance companies when their drug coverage was denied, pursuing compassionate programs to cover the co-pays, and getting 100% coverage for those patients who are cash-paying customers without insurance. The team develops personal relationships with our patients and families as their advocate. Their care and compassion is beyond the call of duty, with Emily always at the forefront. The Patient Safety and Quality Care Team on Inpatient Surgery worked to improve quality outcomes and care for Emily and her family. Patient safety is a daily priority and reviewed at huddle boards. Data is shared to show progress, opportunities for improvement, and recognitions for wins related to hand hygiene, falls, surgical wait times, weighted cases, patient satisfaction, finances, and much more. Timely evaluation and follow-up of incidents occurs with feedback to staff, so positive changes can be implemented in real time. The team focuses daily on interdisciplinary communication and therapeutic relationships with Emily. Several team members participated in developing quality-based procedures and have participated in best practice teams. They implemented the best practice pain guidelines to improve patient pain experiences. Order sets were developed and targets were measured to monitor effectiveness of changes. The team was part of the pilot for the initial implementation of the electronic medication record and medication reconciliation. They provided positive quality input to ensure medication administration and instruction were accurate and clear. The focus was on the right patient receiving the right medication every time in hospital and upon discharge. All team members received training, which helps staff interact with patients in a more compassionate and approachable way. The team has been in the top 10% of the province for the patient satisfaction survey results. Team members work to do discharge phone calls to all patients within 72 hours of discharge to ensure we have provided a positive experience for Emily and her family. If the experience was not at the standard expected, then an incident is made out and follow-up is done within a couple of days. Learning from Emily is discussed and quality improvements designed to ensure positive experiences.